It was quite an interesting and exciting disease monitoring session today. We had multiple areas where we can really improve on how to diagnose patients early, but also how to monitor them to really assess that deep remission and potential cure in many of our patients with myeloma. And we talked about multiple aspects of how we can improve on disease monitoring for our patients, including better imaging. We want to do more than just doing an MRI or a PET CT scan for our patients. We'll no longer talk about skeletal surveys, and that's the good news here. We then went on to talk about mass spectrometry and how that can really change the way we think of a serum protein electrophoresis. Again, think of SPEP as a 50-year-old technology. We can improve on this, and by seeing more sensitive tests, we can really detect those earlier monoclonal proteins either early in screening or also later as you get into MRD disease, and it can improve on what we do in the bone marrow with our MRD testing right now. And then we went into the immune microenvironment, and that's the new novel area that we have right now. It's really complementing the MRD and the tumor measurement, because there are two parts of the ecosystem that we have in a cancer. There is the tumor cells, but there's also the immune cells. And most of us talk about the tumor cells and measuring what happens with the tumor cells, but we never talk about how the immune system is critical for early diagnosis and deciding whether a patient will progress to smoldering and to active myeloma, and how can you use that immune system to predict progression, but also can you use it to predict response to therapy. And our data shows that indeed by using your immune system, looking at the transcriptional and the compositional changes, you can predict whether someone will respond if they have a reactive immune system ready to attack basically the cancer cells, but also at the end of therapy, whether you normalize the immune system, sort of an immune MRD instead of just the tumor MRD, and whether that can predict long-term outcome of our patients. And there's a beautiful discussion at the end where we said our goal is really getting 5-year remission without evidence of disease and without actually therapy, and that could potentially be the new cure for us. Can we measure that and call this cure if someone has no evidence of disease and potentially not in therapy for 5 years?